A lot of parents are coming in with questions about reflexes, reflex integration, and reflex therapy, and I kind of want to give some background information about the reflexes to help parents understand and make educated decisions about what they're going to pursue for those reflexes. So first off, there are two types of reflexes. There are postural reflexes, and these are the good ones. So as you start to lose your balance, you're going to put your hands out to catch yourself. This is a really vestibular and proprioceptive with the neck muscles and head position. And this is something you want your kiddo to develop. A lot of kiddos who don't have a lot of movement experience, or they're stuck in that frontal movement, they don't have those postural reflexes to the back or to the side. So a lot of what we'll do is movement on dynamic equipment, all those swings and everything we have back there is to give them that input and to help them have those reflex patterns. The other reflex, and the one that's more commonly coming up, is primitive reflexes. So these are reflexes as a child or an infant that you're born with, and they help you become more move and engage with your environment. So they can be anything from orienting to sounds to eliciting postural tones, so that you as an infant can kind of move and engage with the environment. So as you grow up, you integrate those reflexes, and what that means is that you take those reflexes and you build off of them, so that when you have those environmental input, you don't have that reflex anymore. Instead, you have a more mature motor pattern. What's happening now, and has been a common trend, is a lot of kiddos are coming in with unintegrated reflexes. So when they should have been using those reflexes to build more mature motor patterns, instead they're still relying on those reflex patterns, or they haven't had the movement experience to build off and make more mature ones. So a lot of people are coming in and saying your child has unintegrated reflexes because they have difficulties with this movement pattern, or they have poor handwriting, or all these. And some of the studies have shown a relation between reflexes and those behaviors, but I think it's much more complex than that. So what we do here is there's a simple test you can do for a lot of the primitive reflexes, and when that primitive reflex is elicited, we here make sure that we do movement patterns to help integrate those reflexes, but we don't stop there. We build off of those so that they become much more mature in their motor patterns, and then they're able to use functional movements. Companies that come in and say, like, you need to do reflex therapy, it just doesn't quite make sense, in the sense that you can't stop at that basic level with reflex integration. You've got to build off of it. And I think that's one benefit that OT has when it comes to the reflexes. So if you have concerns about your reflexes, or your child having primitive reflexes still there, you really need to communicate that with your OT. She can do a simple test, and she can show you the reflexes that aren't integrated, and then she can give you a home exercise program to integrate it. But everything that we're doing in the gym, the crossing midline, all the playing on the equipment, is to help integrate those reflexes. So I don't think it's like you should choose OT or you should do reflex integration. I think that the two are very married together, and that they should be done together.